Good morning, and thank you for joining us for this webinar for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care Division and Fiscal and Administrative Services Division. This webinar is being held on September 17, 2021, and is scheduled to run from 9 a.m. until 11 a.m. As a reminder, this webinar is a two-part series. The first hour will provide general updates as are typically included in our Friday webinars, while the second hour we will present on the American Rescue Plan Act, or ARPA, survey that is required for all state preschool contractors to complete. And with that, I would like to welcome Virginia Early, the Administrator of the Policy Office.
Hi, everyone, and thank you, Mai. As Mai mentioned, my name is Virginia Early, and I'm the Administrator of the Policy Office at the Early Learning and Care Division. Welcome to our webinar. So I want to just point out that, as Mai just mentioned, this webinar will look a little bit different from our previous webinars, as it has two parts. We encourage all of our state preschool contractors to remain on the webinar through the ARPA survey portion, as we hope to answer questions that contractors may have as they fill out that survey. We'll be taking a short break between part one and part two. We would also like to acknowledge those of you that celebrated Yom Kippur this year. We hope you had a meaningful fast and were able to take the time to celebrate with family and loved ones. And as always, throughout this pandemic, we want to encourage you to wash your hands, wear your masks, and get vaccinated. We have the tools to protect our children as well as our communities. We just need to use them. So before we move on, I want to remind you all about the purpose of this webinar series moving forward and some upcoming changes that we're anticipating in our division. First and foremost, I want to remind everyone that these webinars hosted by CDE will only include information and guidance for preschool programs. For example, the California State Preschool Program, or CSPP. So while we appreciate that many of the requirements for programs at CDSS are similar or the same to state preschool requirements, we want to make it clear that we do not have the authority to address questions related to programs that CDE no longer administers. So just wanting to throw that one out there. In terms of the schedule for these webinars, we're planning to hold them monthly to keep all of you informed with any changes and provide you an opportunity to ask questions. We'll monitor the need to adjust the frequency of this series or webinars on specialized topics as we work through the budget pieces around implementation, guidance, and our continued pandemic response. So we also have some exciting new possibilities coming up as Universal Transitional Kindergarten begins to roll out. So keep a lookout for CDE's upcoming P3 webinar announcements and newsletter to keep all of you informed. I'll now turn it over to Alana, who will be our moderator today.
Good morning, everyone. Happy Friday. I'm Alana Andrade, and I'm a child development consultant here at ELCD, and I'll be your moderator today. To help answer your questions and to make this webinar run smoothly, or both of these webinars run smoothly, we have a great team with us as usual. From the policy office, we have consultant Danielle Davis and office technician Mike Dow. From the program quality implementation office, we have education administrator Crystal Devlin, consultants Cassandra Lewis, Richard Miller, Amy Silva, and Nadia Kersey. From the Child Development, Nutrition, and Fiscal Services, we have managers Andrea Johnson, Alan Lynch, and Kate Washington. From the Data Research and Planning Office, we have Data Research Manager Jane Liang, and analyst Josephine Chang, and Carly Nodahara. And from the Director's Office, we have analyst Brianne Rude. I'd also want to warmly mention our Technology Service Division, who ensures that our web link is working and is live for every webinar that we host. They also help ensure that there's closed captioning for you to utilize during the webinar. To turn it on, you can click the CC button on the bottom right of your screen. As usual, our team is committed to being as responsive as possible to any of your questions. And per the course, we're not able to answer every question. And just a reminder that our chat box is disabled. CDE will be able to share links with you there, but you're unable to chat with us. Please utilize the Q&A feature to ask us any questions. Also, when you do ask questions, do give us as much detail as possible. We notice that sometimes questions are submitted that are a little bit incomplete, and we want to make sure that we understand fully the context before giving you a response. So back over to Virginia to review the agenda for today.
Thanks so much, Alana, and again, welcome. So let's take a look at this morning's meeting agenda. So first, we're going to provide you with an update on various budget-related items and provide some information on the 12-month eligibility regulations, abandonment of care, and policies around sheltering in place, because we know that there are a lot of questions on those pieces. We'll then give you some information on new management bulletins that have been recently released. So including the Family Fee Management Bulletin, the Reopening, Reimbursement, and Distance Learning Management Bulletin, and the Non-COVID Emergency Closure Management Bulletin. So lots of budget updates, policy reminders and updates, and new management bulletins. And finally, we'll address the proposed federal vaccine requirements. So while we work through questions in real time, we'll visit some questions that have come in through the Q&A function, as well as others that you may have lifted up through other modes. As we do with each webinar, we'll take your unanswered questions and work on answers to post as FAQs on our website. So without further ado, I'm going to move us into our next slide for budget updates. So there were some recent cleanup budget bills that made some technical changes, both to the past budget that we want you to be aware of. They're in AB 167, 168, and 170, and these impact state preschool. These are, I believe, on the governor's desk for his signature. So they're not law yet, but we wanted to make you aware of this. So the first big change is that there's changes to allow California State Preschool Program, or CSPP, as a wrap program for transitional kindergarten and kindergarten age children. So there's also language giving CDE the authority to implement rate reform without having to go through the regulatory process before implementation, which gives CDE more time to work together with DSS on a couple of sticky implementation issues that exist when transitioning programs from the SRR that are on the SRR to the RMR, including related to time-based adjustment factors. And then there's correcting some statutory references to refer to updated education code sections as things have changed around due to the transition. The other change is that the TK planning grant allocation has been updated. And so there are a couple changes for that one. The biggest one is that the base grants for LEAs that have kindergarten programs, that methodology has changed. The reason that this has changed is that the previous allocation methodology was going to create some funding disparities between districts that had more or less children in kindergarten. So, for example, under the old language, districts that only had one kindergartner would receive a full $100,000 for planning, which resulted in larger districts with more students getting less funding. And so the new methodology gives LEAs with 1 to 23 kindergarten students a $25,000 base grant, 24 to 99 students a $50,000 base grant, and LEAs with 100 or more kindergarten students a $100,000 base grant. So it also specifies that the pieces of this allocation that are tied to the number of kids you have, it's tied to the number of just the actual kindergartners, not tied to the number of existing TK students you have. And then the language around the county office base grant has changed, but in terms of the actual math, county offices will still get the same amount as they would have before. And happy to answer questions about that. Before, they were going to get 15% of whatever base grants their districts got. So 15% of 100,000 is 15,000. Now the language says that they're going to get $15,000 per LEA in their area. So we are currently calculating on how much funding each LEA and the state will receive from this, and we do anticipate that these grants will be critical as the state works to implement universal preschool, because it gives LEAs and counties the ability to have some resources for planning and meeting their needs as they work to ramp up. I'm going to now have Danielle to come on to talk through some information on the 12-month eligibility regulations.
Hi, everyone. Welcome to the Friday webinar. So excited to be here. So let's get started on the 12-month eligibility regulations. We're not going to go into a ton of details today, but we did hear some feedback from the field recently that a lot of people maybe do not know where to access the regulations, or were having trouble finding where they could get them, or didn't even know that the regulations had changed. So today we're just going to discuss a little bit of where you can find them and how you can access them easily on the internet. So the 12-month eligibility regulations went into effect on July 1st of this year, 2021. So meaning all of the requirements in these regulations should be followed by contractors as of July 1 of this year. However, the CDE has historically had a window of time where contractors are given technical assistance and they're able to reach out to their consultants to make sure that they understand the regulations, et cetera, in order to meet these new requirements, rather than us going straight out and implementing a punitive monitoring strategy right away. And the intent is to continue that same practice for these regulations. So please don't panic if you didn't know that they were even changed at this point. But we do want to make sure that it is clear that the expectation is that contractors are moving toward compliance at this point, and that you're getting to this pretty quickly, because a lot of these changes in these regulations really affect family eligibility, and we want to make sure that families are benefiting from these regulations. So ELCD encourages contractors to review the finalized regulations in their entirety and then submit any questions related to these regulations to the ELCD Title V at cde.ca.gov inbox. That's our Title V inbox. And the link is on the screen, and we'll also add it into the chat. And then if you have any questions, they could be added to upcoming frequently asked questions, but we do ask that any questions you submit with your agency name, the region, and your consultant name if possible, so that we can make sure that we get you to the correct person to give you the technical assistance needed, because we understand that these are very complex changes, some of them, and we want to make sure to give you technical assistance rather than just throwing out answers that may not be so helpful to you specifically. It's important to note that these regulations are applicable to all Title V programs, including those that did transition to Department of Social Services on July 1st. However, CDE will not be addressing questions that come in about CDSS contracts. So we encourage you to send those to your consultants at CDSS if your contracts are administered by CDSS at this point. The final version of these regulations can be found on the CDE's rulemaking webpage by clicking the 12-month eligibility link, and then going down to the bottom where it says the final regulations document, and it's a link. It'll take you to a new page, and it'll populate it into a Word document, so you can see all of the changes that were made to all of the sections that were affected by the 12-month regulations. And then there's also another way for you to look at it. So you can do that, which is one way, or you can go to the Thomson Reuters Westlaw website, which is the official California Code of Regulations website, where it has the most updated changes to any regulations across the state. And you can access them that way by looking up Title V regulations. Chapter 19 is the regulation chapter that ELCD programs, Lion, and then CalWORKS programs are in chapter 19.5. So it looks like Alana has already put those links into the chat for me. Thank you, Alana, and thank you, Bree, for the email. Again, send any questions to that email for CDE programs, and any questions about CDSS programs, please forward to your consultant at CDSS. And then if you need to access the regulations or you didn't know where to access, you can access at either of the links that have been provided in the chat. Okay. And then I think next I'm going to go on to talk a little bit about abandonment of care, because we know this has come up quite a bit for contractors, especially in the middle of COVID. So we just want to sort of address some of the questions that we've gotten. First and foremost, you can find the abandonment of care policy. It was within the 12-month regulations, and you can find it in section 18066.5 of Title V regulations. Again, that's section 18066.5. And then one of the most asked questions that we've received is, what is abandonment of care? What does it mean? So pretty simply put, abandonment of care occurs when a family has not been in communication with the provider or the contractor for 30 consecutive calendar days and has not notified the provider or the contractor why the family has not been using services. And it is important to note here that even if a family is not attending and the absences are considered unexcused, it is only considered abandonment of care when the family has not communicated with the provider or contractor the reason that the family is not using care. So that's something that we really want to make clear here. It's if the family has not communicated, you don't know why they're not coming to services, you've called them, you've reached out, you haven't seen them, that is when it is deemed abandonment of care. We've also been asked multiple times if excused absences are included in the 30 consecutive calendar days that lead to abandonment of care. And the answer to this is no. So if a family has an excused absence, they have reached out to the contractor or the provider to let them know the reason why they haven't attended care, and therefore it cannot be considered abandonment of care because they have communicated. Also, excused absences are reasonable circumstances in which a family would not be in care. So we're not holding those against families either. So it is only unexcused absences where the family has not contacted providers or contractors that leads to abandonment of care. Okay, and I'm sure we'll have plenty of questions in the chat, and I'm happy, or the Q&A, and I'm happy to answer them as they come in. But I think next time we are going to move to, the next slide we're going to move to is the shelter in place, because this has come up a lot with, like, in conjunction with abandonment of care, and sort of the confusing, contractors have been a little confused of, is sheltering in place considered abandonment of care, etc. So a lot of the questions we received is kind of how to deal with a family that wants to shelter in place at this time. So first and foremost, the CDE strongly, very strongly encourages all families and contractors to encourage all families to use in-person services safely. We understand that we're in the middle of a pandemic, so there's a limit to the abilities of contractors to open fully or provide safe services, etc. But we want to make sure it is very clear that the expectation of CDE, and that we are strongly encouraging all contractors to provide in-person services and families to use in-person services. We know that in-person services are way more developmentally appropriate and are able to meet the needs of young children. And that is the point of our California State Preschool. We really want to make sure these children are getting the services that they need and that they deserve. We know that COVID-19 hasn't gone away. We're still in the middle of a global pandemic, and we seem throughout this whole last 18 months, we've seen to be getting ups and downs where, cases rise and they fall, but we want to make sure that it is clear that we understand why some families are not comfortable yet bringing their children, but we would like you to encourage all possible to bring their children to the program. We've heard a lot recently from contractors, if families continue to shelter in place, can they use that? Can contractors deem that a family emergency? So simply put, yes, during this global pandemic, we at the CDE recognize that this is a reasonable circumstance that can be included as family emergency, and therefore these absences would be excused absences. Um, we have also been asked a lot if families should be disenrolled for abandonment of care if they are sheltering in place. And the answer to that is no. If a family has communicated to the contractor that they're not using services because they are choosing to shelter in place and they don't feel that it's safe for their child to be in the classroom right now, then the family has met the requirement to communicate with the provider or the contractor and therefore do not meet the requirements of abandonment of care. And therefore they can't be disenrolled for that specific reason. While we understand the frustration that this would lead for some contractors and the frustration that contractors are feeling when you have a lot of children on the wait list, we just want to remind everyone that the whole purpose and the intent behind 12-month eligibility was to ensure that families have stable access to care for at least 12 months and to ensure that the family does not lose access to care even when there are non-temporary changes or non-permanent changes to the family circumstance. We understand that COVID seems to be a very long temporary circumstance, but hopefully it is a temporary circumstance. And so we are moving forward with these families should not be disenrolled at this point for sheltering in place. We want to make sure that they're getting access to their 12-month eligibility. We want to make sure that we are meeting the requirements of the law and making sure that families who really need access have access. If you have any questions, feel free to reach out to your PQI consultant. As we know, a lot of these questions are very specific to your programs. And so we want to make sure that you are getting technical assistance if you need it, but we're always here to help. And then the next thing I think I'm going to talk about is our family fee management bulletin that will be out shortly or maybe has been posted this morning. I'm not quite sure yet. It's been a busy morning, but it will be out today if it is not already out this morning. So this will be Management Bulletin 2112, which covers the waiver of family fees for full day state preschool families through June 30th, 2022. So this management bulletin covers the assessments, collection, reporting, and waiver of family fees for full day families through June 30th, 2022. So just some important highlights to note from this management bulletin. Fees are still required to be assessed at initial certifications and at recertifications. The notice of action should include information that the fee will be waived through June 30th, 2022, and school-age children must be assessed vacation schedule and a school schedule family fee. So it's important to note here that the reason we still have to assess this is we have to assess fees for all families, no matter, even if the fees are waived, is to ensure that contractors can report the correct family fees being waived, and then that family can be notified of the correct amount of fee that will be applicable to them as of July 1st, 2022. So it's important to note this because previously the guidance before 12-month eligibility regulations came into place was that when the new fee schedule came out, contractors would reassess all families' new fee. However, that process has changed because of 12-month eligibility regulations that do not allow for that. So the fees that are in place currently for a family may continue past July 1st next year. So we want to make sure that they stay in place and families know what is expected. It looks like we're having some issues with the slides for a second. I think it's the next one after that. Yep, perfect. Okay, so then just to note, so contractors will no longer reassess fees with the issuance of the new fee schedule. All fees will only be updated to align with the new schedule at recertification or initial certifications. Contractors are encouraged to remind families of their right to voluntarily request a reduction to their family fee at any time during their 12-month eligibility period. And they can do that if a new fee schedule comes out and the contractor lets them know, hey, this looks like it might reduce your fee. If you want to submit a voluntary request, we can look at it and assess your new fee for you. So we want to encourage contractors to put that out there for families so they know. And then we want to let you guys know that you're still going to be reporting the amount of family fees that are waived on the line family fees waived for certified children in your reporting requirements. So for each reporting period, the amount reported in this field should represent the amount of fees that would have been collected from families if the fees had not been waived. The contractor's reimbursement will not be reduced based on the amount of fees waived or reported. An additional allocation will be provided to all CSPP contractors to ensure that you do not have to absorb the cost of these family fees. And that is really important for everyone to know. No reductions to your reimbursements. So again, if you have questions, feel free to put them in the Q&A. We're happy to answer. And then I'm going to pass it over to Crystal to discuss our other management bulletins that will be released shortly.
Thank you, Danielle. Good morning, everyone, and welcome to our Friday monthly ELCD webinar. I'm happy to announce that Management Bulletin 21-11, Reopening, Reimbursement, Distance Learning Plans, and Distance Learning Services Requirements for California State Preschool Program Contractors has been released this morning, September 16th. I do want to acknowledge that a couple of folks have posted in the Q&A that the links to the forms within the management bulletin are not currently working, and we do have our IT folks addressing that issue right now. Excuse me. So throughout the management bulletin, you will notice many references to a local or state public health order or guidance. Well, this is defined in the management bulletin. I want to be sure that you all understand what we mean by that. So when we refer to a local or state public health order or guidance, we mean written orders, advisories, or guidance related to the COVID-19 pandemic and specific to early education or childcare that is issued by a local or state government agency. These might be the California Department of Public Health, the CDPH, your local public health authority, your regional child care licensing offices, or other governmental agencies. If you're not sure about whether the guidance meets the criteria, please reach out to your assigned regional consultant for additional guidance. Regarding reimbursement, pursuant to Assembly Bill AB 131, Section 263 for fiscal year 21-22, CSPP contractors will be reimbursed the lesser of 100% of the contract's maximum reimbursement amount, the MRA, or net reimbursable program costs, so long as they meet one of the following requirements. You're open to provide in-person early education services for enrolled families in accordance with the contracting agency's fiscal year 21-22 approved program calendar, and remain open and offer services through 2021 program, 2021-22 program year, or you're not open and providing in-person services by the start date of your fiscal year 21-22 approved program calendar due to a local or state public health order or guidance that prevents your program from reopening, or you open for in-person services in accordance with your approved fiscal year 21-22 program calendar, and any future days of closure are due to a local or state public health order or guidance. If a CSPP contractor does not reopen or closes and does not provide in-person services to enrolled children, and it's not due to a local or state public health order or guidance that requires them to close, or you close and it's not due to a non-COVID-19 emergency closure, which we will cover later in this webinar, a revised program calendar for fiscal year 21-22, along with the program narrative change, will need to be submitted to your assigned regional consultant, and the minimum days of operation for your program will be adjusted accordingly. Contractors will not be reimbursed for closures that do not meet one of the previously mentioned requirements. CSPP contractors who provide services through a family child care home education network, a FITCHN, must also reimburse providers who are closed or required to limit group sizes due to a public health order or guidance. Additionally, providers who serve children through a CSPP FITCHN are eligible to receive reimbursement for up to 16 non-operational days for other closures related to COVID-19 and that are not due to a local or state public health order. These types of closures include, but are not limited to, COVID-19 testing or vaccination, a known exposure to the virus, sanitizing to ensure a safe and healthy environment for children, etc. We do recognize that this directive is retroactive in nature and that some providers may have already had closures related to the COVID-19 pandemic prior to the signing of Assembly Bill 131 and the release of Management Bulletin 21-11. This may require CSPP contractors to process adjustments that were not previously reimbursed for non-operational days of closure for closures that are related to COVID-19 and were not claimed by providers since July 1, 2021. Contractors must notify providers of the retroactive directive and provide them with the option of requesting an adjustment to be reimbursed for retroactive closures related to COVID-19 for which the provider was not previously reimbursed. Contractors should prioritize these adjustments as quickly as possible. Finally, CSPP contractors must reimburse providers serving children through a CSPP FITCHN based on the family's maximum certified hours of care, regardless of attendance. And for families certified for a variable schedule, the contractor must reimburse the provider at the maximum authorized hours of care, again, regardless of attendance. When the CSPP contractor or a provider who serves children through a FITCHN is required to close any site, classroom, or home due to a public health order, they must submit the notification of closure due to COVID-19 form, along with a copy of the local or state public health order to their assigned regional consultant. This form can be accessed via the link included in Management Bulletin 21-11. And again, we are working on fixing those links at this time. Now let's talk about distance learning plans and services. CSPP contractors who are closed due to a local or state public health order or guidance, or who are unable to provide in-person services for all enrolled children due to capacity limitations required by a local or state public health order or guidance, must submit a distance learning plan to their assigned regional consultant and provide distance learning services for all children who are unable to receive in-person services. In Management Bulletin 21-11, there is a template for the distance learning plan, which is what you will complete and submit to your assigned regional consultant. If a provider who serves children through a CSPP FITCHN is required to close or limit capacity due to a local or state public health order or guidance, the CSPP contractor must collaborate with the provider to offer distance learning services for enrolled children who are unable to receive in-person services. Providers who are closed and being paid to be operational must participate in offering the distance learning services for children. We'd like to note that CSPP contractors are not required to provide distance learning services for families who choose to shelter in place due to the COVID-19 pandemic. Contractors should strongly encourage families to return to in-person services to ensure that their child or children are receiving ongoing early education services. Management Bulletin 21-11 does provide specific information regarding the requirements for distance learning services, which I will not fully cover now, but I do want to emphasize that CSPP contractors are not required to offer distance learning services through virtual online interactions and should consider families' access to the technology required to participate in such type of interactions. Distance learning services may be offered through various methods to maintain the developmental progress of currently enrolled children that are not receiving in-person services. And these services and outreach efforts may include, but are not limited to, home activity packages, lending libraries, phone calls, text messages, emails, online learning platforms, and or video. Contractors preparing activity packages should ensure the delivery of these packets comply with all social distancing requirements. If distance learning services are offered through virtual online interactions, examples of a maximum appropriate timeframes for distance learning activities are 30 minutes per program day for children 2 to 3 years of age, and a maximum of 45 minutes per program day for children 3 and 4 years of age. Lastly, Management Bulletin 21-11 also specifies priorities for in-person services when capacity is limited due to a local or state public health order or guidance. If you have questions about these priorities, please contact your assigned regional consultant for technical assistance. Now, I will invite Alan to talk through the fiscal reporting requirements.
Thank you, Crystal. My name is Alan Lynch, and I'm a manager in the Child Development and Nutrition Fiscal Services units. We wanted to make sure to cover their fiscal reporting requirements based on the information provided in Management Bulletin 21-11. The next few slides contain information about specific fields the agencies will fill out as part of their CD&FS fiscal reports via the online Child Development Provider Accounting Reporting Information System, or CPARIS. These slides contain tables that might be familiar to contractors who read the Management Bulletins from 2021 or were present for our webinars last year. They are very similar, but have been updated and simplified to reflect the guidance for the full 21-22 fiscal year. The CD&FS reporting requirements for the days of operation, days of enrollment, and days of attendance are generally similar to how they were reported last year. Though we have been getting questions, so we want to make sure to review this information in detail as part of this webinar. So first up, we have how to report the days of operation in the 21-22 fiscal year. So on the report form, contractors should report days of operation for the program when it is A, physically open and providing in-person services for children and families, or B, not physically open due to a written local or state public health guidance or orders, which Crystal defined a little more clearly on the previous slide. It is important to note that programs will not be funded for days that they do not meet the criteria of either A or B. If a contractor does not meet either criteria, they will not report the days of operation for that time. The contractor will need to submit a revised calendar to ELCD, and we must amend the contract to reduce the days of operation and prorate the MRA accordingly. The next reporting field we want to go over is the days of enrollment. For the 21-22 fiscal year, a program should not report the enrollment associated with days of operation. Should report the enrollment associated with the days of operation only for enrollment on days when the program is, again, A, physically open and providing care, or B, the days the program is not physically open due to written state or local public health guidance or order. As you can see, this mirrors how contractors are reporting their days of operation as described on the previous slide. Once again, programs will not be funded if the enrollment does not meet criteria A or B, and contractors should not report the days of enrollment associated with days that do not meet either criteria. Okay, so the final reporting field we want to review is the child days of attendance. This field has a number of different scenarios and is a little more complicated than reporting days of operation or days of enrollment in fiscal year 21-22. So let's take a look at each of them in turn. The first scenario is a child who is participating in distance learning activities due to a temporary closure caused by COVID-19. In this case, do not report these days as days of attendance for that child. The second scenario is a child who is sheltering in place with no intention of participating in in-person care, again, due to COVID-19. The contractor should not report these days as days of attendance either. The third scenario is a child who is unable to attend due to capacity limitations related to COVID-19. Once again, do not report these days as days of attendance for that child. The next scenarios are basically the same as prior fiscal years and should seem a little more straightforward. Our fourth scenario is a child who is actually participating in in-person services. As you might expect, contractors should report the days of attendance for any child that was expected to physically attend the program and is actually present in the classroom. Lastly, we have a child who has an excused absence. If you expect a child to be receiving in-person services, but the child did not attend due to an excused absence, you should report those excused absences as days of attendance. It is important to remember that excused absence policies should continue to be followed for children receiving in-person care. Excused absences include family emergency, and illness of the child or parents, which also includes a positive COVID-19 case in the family. The expectation here, though, is that the child will return to in-person care. Conversely, if a child who was expected to be present in the classroom to receive in-person services did not attend for a reason that would not be considered an excused absence by your agency policies, you would not record that day as a day of attendance. That is also standard procedure from prior fiscal years. In summary, like the reporting requirements in previous fiscal years, contractors should only be reporting attendance for children who are present for in-person services or who are expected to be receiving in-person services but have an excused absence. All other scenarios will result in not reporting the days of attendance. And now back over to the PQI office for additional management bulletin information.
Sorry about that. I was trying to get off mute. And it's Crystal again. So now let's talk a little bit about Management Bulletin 2110 regarding non-COVID-19 emergency closures. Any CSPP contractor that is unable to operate and has to close all sites and/or classrooms due to a non-COVID-19 related emergency may request a closure credit for any reduction in days of operation. This includes providers serving children through a CSPP Family Childcare Home Education Network. Non-COVID-19 related emergencies include circumstances beyond a contractor's control, including but not limited to earthquakes, floods, or fires, as well as incomplete repairs and renovations that have been authorized by the department. There are certainly other things that may require an emergency closure, and we understand that there have been a lot of staffing issues where contractors have to close because they are unable to meet staffing qualifications and/or meet ratio requirements. In these instances, an emergency closure approval request may be authorized when the contractor can demonstrate that they have made substantial efforts to retain or recruit staff, or that they have made efforts to employ substitute staff to meet the minimum requirements of staffing qualifications and/or meet ratio requirements in order to provide services for enrolled children. CSPP contractors that close all of their sites and/or classrooms due to a non-COVID-19 emergency closure must submit the non-COVID-19 emergency closure request form in order to receive credit for any reduced days of operation associated with the emergency closure. The non-COVID-19 emergency closure request form can be accessed at the link included in Management Bulletin 2110 and must be submitted to the contractor's assigned regional consultant. If the request is approved, the contractor will receive an approval form indicating the days of operation credit for the non-COVID-19 emergency closure days. The contractor must keep the approved form for auditing purposes and report the associated credits on their Child Development and Nutrition Fiscal Services, CDNFS, fiscal and attendance reports. Again, providers who serve children through a CSPP Family Childcare Home Education Network that are closed due to a verified non-COVID-19 emergency closure shall be reimbursed by the CSPP contractor for such closures. As a reminder, contractors must report non-COVID-19 emergency closures to their regional childcare licensing office if the contractor is a licensed childcare facility under the jurisdiction of community care licensing in accordance with the California Code of Regulations, Title 22. Now I'll pass it back over to Virginia to share information about federal COVID-19 vaccination requirements.
Thank you so much, Crystal. I appear to have some technical difficulties, so can someone confirm that I'm hearable?
We can hear you, Virginia.
We can hear you.
Perfect. Thank you. I'm sorry to have lost video, but federal vaccine requirements. So we know that there have been several recent developments on vaccination requirements that you're likely actively monitoring. So for example, we're aware of proposed federal vaccine requirements for employers with over 100 employees, and then also the requirement for Head Start staff to be vaccinated. However, CDE is not the state agency that would issue vaccine guidance or have vaccine requirements for state preschool staff. So we understand the confusion and uncertainty that many of you are feeling trying to determine what rules apply to you in the midst of the pandemic. So while we won't be issuing vaccine guidance ourselves, we'll be closely monitoring guidance from other state agencies and tracking it to provide the field with any updates on vaccine requirements as soon as there are any to provide. So I'm now going to hand it back over to Alana to get us started on the question and answer portion of the webinar.
Well, there certainly are a lot of questions. Hello, everybody. I would just state that a lot of your questions were very specific while our presenters were presenting information. Sometimes it's a lot to listen to, which is why we recommend also putting your closed captioning on. Sometimes it's easier to read while you're also listening. And so a few of them were also very specific to your contract. So I will do my best to try and pull some things out that will be a little bit helpful for everybody to hear. First, I'm going to call on Virginia, and who we could hear absolutely fabulously, even though we lost her video. There are some questions regarding wraparound care and CSUP wraparound care. Let's see if I can pull one open while you are getting unmuted.
I am unmuted. Can you hear me?
Yes. Okay. So one is, can you please explain in detail what is the meaning of the CSUP for the wraparound care program in terms of TK and kindergarten?
Yeah, sure. So many of you are very curious, of course, about this recent change, and we totally understand that. So a couple things I want to highlight. First of all, this isn't the law yet. This is in a bill that's sitting on the governor's desk waiting for his signature. So obviously we can't tell you to implement something that's not yet the law. The second piece that I would say is that we are working both on an email to go out to the field on this and a management bulletin with more information. We know there are a lot of nuances of this that you all have questions about, which is totally understandable. So so just know that those are on the way and are currently under development. Our goal is to get those out so that you have them as soon as possible. For those of you that really want to really take a look at what's in the bill on the governor's desk, I'm hoping that one of my team that has access to the chat now can put the link to AB 167 in the chat. And that has some specific language in section 21, paragraph L, that is the requirement. And we can also try to copy and paste that in so you see sort of what the proposed statute is that's on the governor's desk to sign. But keep in mind, this doesn't change any existing priorities for state preschool, so you'd still be required to prioritize children in the way that you're currently required to prioritize them, and these folks would come after.
Okay, thank you. So I did put those in the chat for everybody to see. Do let us know if you can't read that. There's also a lot of questions asking specifics about the reporting on the attendance. And so I'm not going to read out a specific one, but I would like to ask Alan to come back and just sort of give a brief overview of what those slides entailed. A lot of the questions that we're seeing are, if it's sheltering in place, how do we record, things like that. So just sort of another brief rough update would be great, Alan. Thank you.
Yeah, definitely. So, I mean, the goal here is to capture the number of children who are actually present in the classroom. Last year, those children who were sheltering in place, even though by your policies that might be an excused absence, we did ask that they not be reported as days of attendance on the fiscal reporting forms. So for children who, or families who are sheltering in place or who are participating in distance learning activities due to temporary closures, even in situations where your policies might have that be an excused absence for that family, we're asking that you not report those as days of attendance on our report forms. So I know I saw a number of questions related to that specifically. I did also see some questions related to emergency closures and how that differs from the more COVID focus of the slides I went over as far as our CDNFS fiscal report. Just remember that, as you have your emergency closures, you're not supposed to report those days of attendance and enrollments until you've received your authorization from ELCD, your approvals. So those will come after the fact. So as you're just submitting your normal reports to us, you would not be including your emergency closure information in there until you've received your approvals. Were there other specific questions you were looking at, Alana, right now?
I think that's it for now. A lot of them, again, were very specific. So do feel free to reach out to your PQI consultant or your CDNFF analyst. So thank you, Alan. I want to call up Crystal. There's a few questions regarding family fees. And I know that there's a few panelists that we have that could also answer these as well. But while we're all typing and trying to get as many answers in. So there was one about, family fees, how can they be waived if the family fee has not been collected?
So I'm going to ask Danielle to answer the question.
Yeah.
The one
Okay.
that was the author of the management bulletin, and she'd be more well-versed.
Sure.
Perfect. Thanks, Crystal. I was just trying to get Alana's attention to tell her that, but that's okay. No problem. So the question is, how can family fees be waived if they were never collected? Correct, Alana? Okay, so the answer to that is simply put, they should all be assessed. However, there's no need to collect them. They are just waived for the program year. I guess maybe I'm not understanding the question more. If there's more context, feel free to add them in. It doesn't have to be collected to be waived, but it does have to be assessed to be waived. Virginia, I see you back. Oh, perfect, you're back. Okay.
Yeah, I fixed my technology difficulties. So the reason that there's a difference between collecting and assessing, and the reason why we need to have those, as Danielle described, is really we need to make sure that from the fiscal side that contractors have the money to cover the waivers, which means we need to know what the fees would have been if they weren't waived. So that's really the rationale. And if anyone else wants to jump in and add more, I know it's a little unintuitive. If they're waived, why do I have to do anything? But it's really from a fiscal standpoint, we need to know the amount of money associated with it. And then also, starting July 1st for families that, families need to know starting July 1st next year what fee they would be required to pay.
Perfect. So again, there's also more questions popping into the Q&A regarding absences and revising attendance reports if folks are sheltering in place and families are sheltering in place. And so I know that people are asking questions that have already garnered answers to. So, and we do see a lot. Do reach out to your PQI consultant as well, and to your CDNFS analyst, and also those management bulletins that are getting posted will have a lot of these answers as well. There is a question about assessing waived family fees. Can I ask either Virginia or Danielle to speak to that?
No problem, Alana. What's the question?
How do I report assessed waived family fees? I know reporting is usually with our friends at CDNFS, but perhaps there's a little bit more that we can answer.
I actually know this answer because it's in the management bulletin. And the answer to that is there is a line that says on the reporting family fees that are waived for certified children. And that is where they will report the total amount of fees waived for children in their programs.
Thank you. So there is more questions about where to find the family fee schedule. Is that the link issue that's been happening this morning?
I'm not sure if it's the link issue that's been happening. I think the fee schedule is within the management bulletin. I think the link issue was with the management bulletin itself.
Yeah, let me clarify on that one. So actually the family fee management bulletin 2112 is posted. There's a link and a placeholder link on the landing page for management bulletins. But we are aware that if you click the link to 2112, it's taking you to a page that says page not working. So we will be working to fix that. So sometime today, you will be able to click that link and have it take you to 2112. And we'll also be sending out emails to our distribution lists about these management bulletins as well. So all of you are getting a preview of coming emails and management bulletins. So we wanted to make sure you had the information since we had this time together this morning.
Yes. And Virginia, will the fee calculator be updated?
Yes, we will be working on updating that as well. Our first priority, of course, was to get the management bulletin itself live.
Perfect. Okay. Awesome. And then there's a few folks who've been asking about getting our slide deck and getting a recording, especially for the one that happened in August as well. They will be posted on our ELCD COVID-19 webpage. As Virginia was just mentioning, sometimes there's a placeholder, and this is where they will go. I'm going to put the link in the chat here. Do give us a bit of grace with this. We do have to go through accessibility, which is why they don't get posted immediately afterward. If there are still questions that after you've read the management bulletins and you still have questions, again, do reach out to your consultants. So we have a few more minutes for this portion. So while our Q&A team will be feverishly answering any outdated questions, I'm going to ask that turn us over to the resource slide. Do stay with us. You can tune me out if you need to. So again, our ELCD COVID-19 guidance webpage is where you're going to find the webinar, is where you're going to find our slides, and where you're going to find the recordings, also those MBs, and also frequently asked questions, which we get frequently asked questions from these webinars. So we're not going to be sending out a Q&A transcript, but what you will be getting is the FAQs will get updated. And then with the webinar recordings is where you'll get to hear this all again. And that webpage is the one that I just put in. You can also email us at the ELCD emergency email inbox. That is at elcdemergency@cde.ca.gov. Also, that ELCD COVID-19 webpage is https://www.cde.ca.gov/sp/re/ELCD-COVID.asp. And you can also find your current regional PQI office consultant at https://www.cde.ca.gov/sp/CD/CI/assignments.asp. And per usual, they're more easily reached by email, but you can also call during business hours at 916-322-6233. And I'll just put those links in here. And I'll also put that phone number as well. And a few of you also mentioned about the closed captioning. Now, I live by closed captioning and I can have it turned on and I see it right now. So perhaps during the next webinar before we start getting going, you can start clicking through and trying to figure out how the closed captioning can get turned on for you. So I'm going to call back Virginia to take us for a break before we get to part 2. But while we're doing this break, we are trying to still answer those questions out. So do keep them coming.
Well, thank you everyone who joined us for the first half of this webinar. And as a reminder, please wrap up your final questions as we will not be answering any questions related to the content we presented in part 1 during the next part of this webinar. We'll only be answering questions that are related to the ARPA survey. So before we get started on part 2, we're going to go on a short break to stretch our legs, and we'll be back to begin the ARPA survey portion of this webinar at 10:05. So just stay logged in, and we'll be back in a couple minutes.